Hi.
Hello.
And welcome back.
Welcome back to our show.
Before we start today's episode, we're going to be talking about our new sponsor.
Yes.
And this is FeedAi. Have you heard of FeedAi?
I have, and it sounds like an amazing product.
Yes.
Because Lord knows that I spend all my time doing my notes
All the time.
and
All
my
the time.
charting and documentation and coding and everything. And then I get frustrated when other people don't do the same thing.
Exactly.
So, yeah.
And then you're not spending enough
you're
time with the patient or at home because you're like trying to catch up.
Yes, I'm always just stuck on charts, and that's that. I really try not to be looking at my computer when I'm talking to a patient, but it's really hard because once that patient leaves the room,
Yeah.
I have to sit down and chart everything or go back home, pajama party,
Yep.
right? And then in bed, start charting, and I'm constantly like, did they say this or they did say that? So then I kind of summarize everything, but
Yeah.
it's so nice to just have something that literally transcribes everything in the moment before the patient even walks out of the room. You already
amazing.
have your documentation ready to go.
Exactly. That's amazing. And I remember also from my husband when he was working at a clinic, he would be back home and just spend so much time just charting and charting and charting away with his little like notes and then putting them into the EMR and stuff like that. So, which is great because when I spoke with FeedAi, it kind of came from that story where her husband, his name is Erez, he's a computer engineer and he created this for FeedAi because his wife was just spending so much additional time, you know, trying to chart away and keep up with the workload and whatnot. So it's a great product. It's being used right now with more than 12,000 clinicians in every specialty. There's over 1 million notes that are written each month using Freed. Of course, it's HIPAA compliant, so you don't have to worry about protecting your patient's safety, which is obviously very important.
Yes. And also, it works as a scribe.
Exactly.
Right? And there are a lot of clinics and hospitals that use scribes. However, I can say through experience, it's very hard even with a scribe because at the end of the day, you're not the person writing that note. So maybe something that a patient said might be transcribed by that person in a different way.
Right.
So it's really difficult because then sometimes you have to double back
Yes.
to fix those notes.
Makes
right?
sense.
So more time. And then also, it was always a bad day when my scribe would call out or quit on me.
Which obviously would not
That would not
happen
happen
here.
with this. Exactly. And also, I will say as well, which I think is brilliant, is that not only does it cover across all specialties, but it covers different languages.
Oh, yes.
So for me, I have a
Wonderful.
high Spanish-speaking patient population.
Yes.
So I was always worried that even if we had one of these systems, I wouldn't really get the benefits of it because half of my visits, or more than half, almost 100% of my visits are mostly in Spanish.
Yeah.
Right? So then I would say, what's the point in having these things or these systems that can transcribe if they can't even transcribe in Spanish? It's amazing because FeedAi can work through various languages. So it's not just Spanish, English, you know, they have
French,
multiple others,
others.
which is amazing.
It's wonderful. I mean, it just obviously it just takes off so much of that burden of like, and so much of that stress of like, you know, okay, let me try to remember that. Let me chicken scratch that so I don't forget that important thing to put in their chart afterwards or whenever I could get to it. It's a wonderful system. It takes less than 30 seconds to get it up and running. So it's not something that you have to spend so much time learning and trying to get used to it and whatnot.
Very user-friendly.
Very user-friendly, easy to use.
I can say personally, every time that someone introduces a new system to me, I'm like,
Of course.
here we go. I'm going to have to sit through a whole entire day of training and it's going to like back me up into my day. And no, it's very user-friendly.
Not the case here. So that on its own is a huge benefit as well, just to get it up and running.
I also think it's fantastic that this came from two people that are experienced with this charting and the world of charting and how much time it can take away from your personal life. So it's very tailored and it doesn't come from someone that has never been in a clinic, has never done charting before. And I think that that is a perspective that is so important and it's really unique to FeedAi.
Absolutely. So go ahead and give it a try. You can try 10 notes for free. And after that, it costs $99 a month. But you can also try FeedAi using our code funny50. And you would have to go to getfreed.ai. And it's so let me just spell that out for you. GETFREED.ai and user code funny50 for $50 off your first month.
And trust me, it is worth it.
It's wonderful. Give that a shot. And now back to the episode. All right. So today we're going to be talking about something that is very much in the now. I know nothing of it. Not a bit. But football season. So what comes with football season in the medical world?
Brain trauma. Yay.
Yeah, here we go.
Which
tackling.
Every single time I see a football player go down.
Oh my God, it hurts
it
my soul.
hurts me.
Yeah.
It hurts me and it hurts my brain. I start having headaches for that.
So we're going to be talking about chronic traumatic encephalopathy.
Encephalopathy.
Falafel.
Encephalopathy.
Yeah, no, it's CTE, guys.
I love falafels. Have you ever had falafels?
Yeah, I have, but I'm not.
Yummy.
I like shawarmas. I'm all about the shawarmas, but
Yes. I love
falafel.
falafels.
Anyway, so we're not talking about falafels. We're talking
I'm
about
talking about encephalopathy. Chronic traumatic encephalopathy.
exactly. But yeah, it hurts my soul whenever I see somebody just like, and it's like sometimes the way they go down, it's like a Mack truck, just like
Yeah. Well, I think then all I can picture in my brain is that they probably just had a bad tackle like 2 minutes ago. And here we are again. And it's repetitive and game after game after game, practice.
oof. I was just listening to, watching, if those of you that are into true crime and whatnot, I'm sure you've heard of Bailey Sarian. If not, you're missing out. But I was just watching her episode on Aaron Hernandez, which coincided perfectly that I was watching that and then we're recording this. I was like, perfect. Anyway, synchronicities out there. And then how bad his CTE was after they did the autopsy.
Yeah.
Apparently there's like 4 levels of CTE and the 4th being the worst, and he was at a level 3.
Yeah.
And his the images of his brain in the autopsy just tolls.
Yeah.
Oh my God. No wonder all the stuff, I'm not excusing any of his crimes or anything like that, but it did contribute to his behavior at least.
Who knows?
It was
But
pretty bad.
it's just a big, I don't think it was talked about before.
No.
And
A lot more prevalent now.
yeah, I think it's a lot more prevalent. And I feel that before you were kind of maybe considered weak if you were to stop playing because of these things.
It's all the macho.
Exactly. And no, there's a lot of football players,
Yeah.
that now it's out there, their brain injuries or concussions that they're having to the point where they have been tackled on the field and they have convulsions.
Yes.
Right on the field. One of them is on the Dolphins right now that he's under scrutiny.
Oh, yeah.
They're deciding if whether
Tua.
yeah, they're deciding if whether he should be playing or not. And then players like Elijah Moore or whatever, and they literally had a convulsion right after being tackled down to the ground.
On the field.
On the field, yeah.
Oh
So
it's rough.
And this is real time. What is happening to your brain? You literally just suffered such an impact on your brain that you had a convulsion. And seizures are scary. I've seen plenty of seizures, and it's still really hard to watch someone have a seizure, let alone being tackled, hit on the head so hard to the point where your body stiffens and has convulsion. And at the end of the day, I know this is their job.
Yeah,
so a lot of them, that's how they explain it. It's their job, and they're willing to take that risk.
And that they knew what they were getting themselves into, all those things.
Yes, but how much is too much?
Exactly.
And when is it? I don't know. Someone drinking alcohol.
Yeah.
Okay, yeah. Sometimes it's just what you do socially.
Right.
But when it goes too far, someone's going to tell you, hey, you gotta
step back.
Exactly. So I don't know if this would relate to that. Maybe that's a bad example that I'm giving. But at the end of the day, it's when is it too much? When a doctor tells you you need to stop because you will not make it past a certain age without developing dementia.
Yeah. And the NFL is a massive business.
Yeah, it's an industry.
It's a huge industry. So they do have the resources to put into And they are like with the new helmets, new padding and all that stuff. But still, like, I mean, they're doing things. So that's good. From like 10 years ago, it was very different to now in regards to that. But it's just, it's like you said, it's like how many repeated hits do you have to take for them to step in and be like,
and again, like, everything is all about autonomy, right? So you make your own decisions for your own body. Like, I'm the first person, the only person that's going to take care of you is you.
Yep.
So I can only do my job as to give you as much advice and recommendations that I possibly can with the evidence that's presented in front of me. I can never tell you 100% what's going to happen to your future, but I can tell you what it is potentially going to look like.
Exactly.
Right?
Exactly. And it's not only football players, it's also boxing.
Yeah.
Is another massive one that has a lot of this. Because
anything that's like really like impact. But then again, it's their choice. They know the risks. But I do feel that maybe there should be a little bit more education around that because
we're seeing it a little more now.
Yeah, I think we're seeing it more now for sure about the education on it, because maybe before then things were just motivated by other factors
100%
to do this kind of job. And really, if you are going to make that decision to stay in a job that may potentially leave you handicapped, you should know all the risks.
Yeah.
You know?
Yeah, absolutely. So let's go into it. So what is it, Doc?
Okay, so CTE.
Like, definition.
Chronic traumatic encephalopathy, it's a progressive brain disease, which means it gets worse over time. It's caused by repeated blows to the head, even though those blows don't always result in a concussion, right? So it's not that the only time that you're going to suffer from this is if you get tackled down and you're like out for like 5 minutes. No, it's not lights out. It's just this repeated trauma to the brain every single time, every single game. It's just you don't get a chance for your brain to really recover. There are patients that take months to recover from a concussion.
Yeah.
So then you have, which I don't know if we're going to talk here, I don't know how you put it, but there's something called the 2-hit theory.
Maybe, but
yeah, so whatever. So there's something called the 2-hit theory, that it's when you are currently recovering from a concussion and then you go and you get another blow to the head. So then you suffer from two hits back to back. And that could be really detrimental and really prolong your symptoms for a long time. And those symptoms of concussions, which we'll go into later, different type of things that you can feel, but it could be extremely off-putting and offsetting, and you don't feel like yourself. You're constantly confused, looking for words, can't concentrate, can't sleep, headache. You just feel off the entire time. And then you go and you do this again, and it hasn't even been a month since you had your last concussion, and then boom, you're down again.
Oof. Which is like totally, you could see that in a football season because
for sure,
they're playing
game after game after game,
exactly.
After
so
practice.
How could they even whatever? That's really the case.
And I can't imagine, because with my patients, I take care of teens, and adolescents and all these players.
But you see them.
No, I do. I see plenty of concussions too. But it's crazy. I tell them that they need to rest from practice, and it's a no. Like, nope.
It's just the pressure.
It's too much. And the parents.
It's the
parents
pressure
are also
to get.
Like, oh, are you sure that long and this and that? And I'm like, well, yeah. And there's like certain protocols that, like it's like kind of a step-by-step fashion to like get back into the game fully. Limited things at practice, and then maybe a little bit more the next time. We take baby steps, right? And you'd be surprised how many times, nope.
There's so much pressure, at least for sports, when we're talking about like CTE and the recovery, the training and all that for sports, because when you're in high school, then you want to get into a college team and all that stuff. And it's like the scouting and...
Yeah. And don't get me wrong.
Oh, boy.
I'm the first person that I want them to have those dreams.
Yeah, of course.
You know what I mean? If that is your passion.
But if you're already a teenager getting like concussions, that's rough.
Yeah. And sometimes, don't get me wrong, I get it. I know that you're extremely motivated and this is what you want to do. And that is really hard. That's a mindset that's really hard to tap into.
Because you didn't really plan for anything other.
But it's really hard for people to understand something in the future, especially when they don't see it every day.
100%.
I see this more.
Yeah.
So I see a lot more complications. Maybe you as an individual person outside in the world don't see that often.
Right.
So you think the chances of it happening to me is slim. That's not.
And it's also like when you're a teenager and when you're that young, you feel like you're invincible.
Yeah, exactly.
You really do. Like, even me, that I was like a female, didn't play sports or whatever,
Yeah.
I thought nothing could happen to me. I was like Teflon, you know?
Yeah.
So imagine these like really fit, really like awesome players in their youth. Of course they're gonna feel like, that's not gonna happen to me.
Yep. Exactly.
I get that. All right.
So people that are usually at risk are going to include athletes who play contact sports like football, boxing, rugby is a big one.
Huge one.
Military veterans who have been exposed to blast injuries, victims of repeated domestic violence. So it's not just athletes, and it's not just like what we're talking about, football. It's just people that are just repeatedly suffering from these blows to the head. And really, like, what happens in the brain when we're talking about this traumatic encephalopathy is that it develops because of these repeated blows, and over time it's going to just cause swelling and all of these things that you need to recover,
which we'll mention a little bit more.
And we'll go into detail, but we'll go step by step, basically.
Yeah.
So the first is like that initial impact.
Exactly.
When someone goes, you have that blow to the head, that impact. And then those are going to be things like in contact sports, military services, small injuries to the brain. This is why we tell you to wear a helmet when you're riding your bike or riding a scooter, which Lord knows I don't see that happening.
Oh my God, no.
Nowhere. Yeah. So then these injuries might not seem really serious at first, but this adds up over time.
Yep.
So then after that initial blow, then you have those small changes in the brain, right? You have something called a protein buildup. So the main thing that happens in CTE is that you have the protein called tau proteins that start to build up in the brain. And then normally tau helps you keep brain cells healthy, but the CTE and its changes, they start kind of clumping up together. So it just creates those like little pockets.
Which is something that you see in Alzheimer's patients.
Yes, you do. We see all these proteins in Alzheimer's.
Well, it's like, just to give you like some type of perspective of what type of protein this is, what type of buildup, what's going on in the brain. It's analogous in the tau protein, at least in the buildup and all that, to Alzheimer's patients. So think of just an analogy there.
Yeah. So that's the dementia that we're talking about.
Exactly.
And then, so you have that buildup of those proteins, and then you start having like that spreading damage, right? So those like clumps, those pockets start to really spread out through your brain. And your brain works on electrical impulses and all these things. So if you have these proteins building up, you're interfering with that function. And then that's just going to start damaging these cells as those proteins start clumping up together.
And they can't communicate as efficiently.
Your brain cells aren't working efficiently.
So think about it as like a wire, like just a regular electrical conducting wire. If you start like putting things in that wire to inhibit its flow, it's pretty much exactly that in the brain, just like millions of them happening at the same time.
Exactly. So then they start like building up around the blood vessels and maybe in the deep folds in the brain, and then they spread to other areas. And then that's when we really start seeing these symptoms. And then a lot of times, like everyone is different. So every impact is different. Every way you suffer and you heal is very differently. So it's so hard. It's not like we can say, hey, 3 hits and you're going to start building up these proteins. We can't say that for certain.
And not every hit is as hard. There's so many things.
Yeah.
So many things.
I wish that they could take MRIs of players before they even do anything.
Right.
And then just compare maybe like a year later or 5 years later.
I think there is like not
a short term.
Yeah. Yeah, there are MRI images out there, but it's not like from the very beginning.
Well, that's what you want to see, right?
Exactly.
You want to see that progression.
100%.
So, and maybe that would motivate people to maybe make those choices. If you see your brain from 5 years ago to now, and you see that difference, maybe it'll give you some solid thing to look at to help you understand what maybe another 5 years can teach you.
Listen, I just saw Aaron Hernandez's like a slice in comparison to a regular brain, and I was flabbergasted. And he was young when he passed.
And that's something that's very crazy to say, because you come from a world where you don't see images often, right? So like you see images like anyone else can look up an MRI,
right?
But if you are a person that you are like, wow, impressed by that difference in imaging, then that's something that's, it's just so obvious. It's so gross.
There's no like, I mean, that image right there, I'll put it right here for anybody that's watching on YouTube. I'll put it right here so you can see it's stark.
Yeah.
Like the difference is stark. There is no like, oh, there's a little bit. No, it's very apparent, and that wasn't even a level 4. Level 4, the highest. That was a level 3. Sad. Anyway, so let's talk a little bit about the symptoms, because like we said, they're a little bit different from person to person, but there are some common symptoms, right? Like she had mentioned, it's a progressive brain disease, right? So it develops over time. And then these symptoms, because it, develops over time, they get worse over time as well. In the early stages, the beginning, they're subtle and they can be easily overlooked because of that. But we're talking about like headaches, so frequent headaches, it's one of the earliest signs, right? But then of course, I had a headache this morning. Everybody suffers from headaches. So that's how like subtle and how easily that could be overlooked. Then you have attention problems. So people may find it harder to concentrate or to focus on particular tasks. And then mood changes. So individuals may experience like some mood swings or become like very easily irritated.
Irritable.
Yeah. And then even like show signs of aggression.
Sometimes this can present as like frustration.
Exactly.
That they're frustrated with something.
Right. Yeah. So then the middle stages, as CTE progresses, the symptoms will become more noticeable. Then they'll start affecting your daily life, such as with memory issues. So your short-term memory problems become more apparent, making it difficult to remember just even recent conversations and events. So that's scary. Then going back to the mood, you have impulsivity. So people may start acting without thinking, making rash decisions, and even saying things that they later on will regret, or it's just out of character. And then depression. So feelings of sadness, hopelessness, and even like loss of interest in your daily activities may become more common. And then aggression. So then some individuals may become more prone to becoming angry and then showing more signs of like outbursts and aggressive behavior. And then you have the late stages of CTE. So this is in the more advanced stages. These symptoms become more severe and they are a lot more apparent and significant into like your daily life and your even ability to function independently. Yeah. So then you have your severe cognitive decline. Thinking abilities are severely affected with major problems in memory, attention, and even problem solving. Then you have motor problems. So it's difficulty in balancing, walking, and just coordinating everyday regular movements. And then you have your dementia-like symptoms. So in some cases, individuals may experience like confusion and disorientation, very similar to Alzheimer's disease. Then you also have severe mood and behavior changes. So extreme mood swings, depression, and aggressive behavior can become more frequent and more intense. Like we said, it's important to note these CTE symptoms because they can vary, okay? These are just some of the very hallmark symptoms, but they do vary in intensity or frequency or even what symptoms actually present themselves. And then the progression of CTE can be slow, and it even could take sometimes years to decades to move from the early to late stages. And of course, remember, only a doctor can properly diagnose CTE, and currently a definitive diagnosis can only be made after death through brain examination, which is one of the hardest things about CTE.
Well, yeah, because we cannot see these, like, how can I explain it? These like tau proteins and things like that. Yes, we can see changes on an MRI, but like really, in order for you to confirm what you are seeing, it's gonna need a brain biopsy.
Yeah, you can't just do it out of a blood test, type of thing. So it's crucial to consult your healthcare professional for proper evaluation and care if you have any worry that maybe you're experiencing some of these symptoms.
Yeah. And then again, like this could be overlapping. Like what's to say that this is an early onset Alzheimer's?
That's what I'm saying.
What I mean, so it's really hard. So you have to like take that history and put it like all into perspective and all these things to really make
a proper
determination and a diagnosis.
Yeah.
But so like Jules was saying, you can have these behavioral changes because of all of this build up and all these symptoms, and it really does mess with your mental state. So mood swings, like she was saying, you can have like sudden intense changes. You can be angry, you can be sad, you can be frustrated. One second you're happy, the next you can't do a task that you used to be able to do easily before. That can lead to aggression, right? People have more violent behaviors because of these mood changes. And then also impulsivity. So it can be harder to control certain impulses. When I'm thinking and I'm angry, I'm able to auto-regulate a lot of my emotions sometimes. However, if you have this progressive disease going on, then that's going to interfere with that. Well, all of a sudden, you are now a more impulsive person. And it's like a vicious cycle.
Right.
It just like when one thing leads to another and leads to another and then circles back to the other thing. And it's like you just keep on going down this like rabbit hole.
Yeah, you're not able to like take that step back and like
Exactly.
see what's really happening.
Yeah. And then along with these swings in mood, then this could eventually really hit hard on a lot of people. That could lead to things like depression. And then that is another circle, right? So you're feeling sad, you're feeling hopeless, you're not able to sleep, or maybe you're sleeping too much, you can't get out of bed, you can't enjoy the things that you used to do before. Hand in hand, anxiety, right? If you have depression, you're high risk to developing anxiety and vice versa. So, you're worried all the time, you're nervous, things that are the tiniest things that would probably not have given you anxiety before is now like
highlighted.
The world is falling on top of you.
Yep.
You can also have symptoms of apathy. So apathy is kind of just like
Just
indifferent. It's just very flat. Like what is that? Like
like melancholia.
Yeah.
Like melancholy.
Like we call it like Eeyore from Winnie the Pooh.
Oh yeah.
He's just very like just flat, no emotions.
Yeah.
So again, it's just that lack of showing interest and enthusiasm on things that maybe you used to have before.
Right.
Okay.
Right.
And then obviously the cognitive impact of it all, right? So how that is going to affect your function every day. Now, obviously, you can have that change your day-to-day habits just with behavioral changes, personality changes. But let's talk a little bit more about cognitive function. So memory problems. You're gonna struggle with remembering things. And imagine someone telling you something or you reading something.
Oh boy.
And you forget.
Yeah. Right. You can't retain it.
Exactly. You can't retain it. So then some people are are you focusing or are you not? Probably not.
Then could lead you to that irritability and all that.
And again, it's a cycle.
The cycle, yeah.
Right? So then you're confused because you can't remember things, and then you can maybe partially remember things, but then now you're confused about certain situations. And then what the thing with cognitive function is that you need to like remember step by step, like a certain sequence of things.
Great.
So that when you can't remember that sequence of things, then all of a sudden you cannot do any complex situations. Everything has to be very single action.
Yeah.
So and that can be really, really tough. And then obviously poor judgment, right? If you make like a decision, like that could be a really impaired decision, leading to maybe choices that you made that probably you wouldn't have chosen if you didn't have all of this going on.
Absolutely.
It's important to note that a lot of these changes typically develop gradually, right? This isn't like you take one hit and that's all of a sudden you're gonna have this. And again, that's really hard, right? Yeah. And like we talked about before, what's to say this isn't something else going on? But these subtle changes at first can like really be ignored. And then it's like really the progressive symptoms after that people start maybe paying attention to it a little bit more. Yeah. And then for family and friends, it's really distressing to see these changes because this person that you probably knew before, and maybe you have a part of you that knows what's going on, and then all of a sudden they start changing right in front of you. Yeah. And that's really, really difficult.
It's rough.
And you have to be that supportive person.
Yep.
Right?
Yep.
But all of that falls on to your loved ones, the closest family members and friends.
Yeah. Especially with people living together and all that. Like you see the daily things like forgetting or irritability, depression, apathy.
And we just don't know when it can happen. It can happen from years to decades later.
It's scary. Yeah. It's really scary. So how is this diagnosed? Well, like I had previously mentioned, it has to be post-mortem, right? So after the person dies, they examine the brain and the tissue specifically under a microscope. So however, researchers are working hard to develop ways to identify CTE while the person's living using brain scans and other tests. They're actively working on it. Obviously, it's a really not bad thing, but it's a
It's difficult.
It's just, yeah, it's unfortunate. It's unfortunate that it has to be like postmortem to be like definitive, like diagnosis for it, you know? So at present, there's no cure. However, understanding the condition could better help to find a way to either treat the symptoms or even prevent it in the future. So remember, CTE is a serious concern. Not everyone who experiences head impacts will develop this condition, but ongoing research is helping us learn about who's really at risk and how to protect people that are. So since we kind of mentioned Alzheimer's and CTE and other neurodegenerative diseases like Parkinson's, let's talk about what are the actual differences. So the cause of this disease, CTE, it's because of repeated blows to the head, as we've mentioned.
It does bother me.
Yeah. There's something wrong with my hair today. Anyway, it's all good. Thank you. So like we had mentioned, CTE is because of the repeated blows to the head. It's like we said, contact sports, military, anything like that, even like repeated car accidents sometimes, if it's like affecting.
Jesus Christ, I hope you're not you're not suffering from repeated car accidents.
I know, but you never know.
Yeah, I know, you never know.
Oh, maybe
it's coincidence.
It's coincidence, you know, maybe. Bless you.
Bless me. Thank you. I meant to say thank you. Thanks.
Anyway, all right. So Alzheimer's and Parkinson's. So these diseases aren't caused by head injuries. They develop due to a combination of genetic factors, such as aging and environmental influences that are still not fully understood. So that's how they're different. CTE, blows to the head. Parkinson's, Alzheimer's, it's very different. Genetics, environmental, aging, other things that we're still trying to figure out. But yeah, it's not that.
And then how the disease starts and spreads, like with CTE, the damage typically begins in a specific area, maybe depending on where that injury was first seen or where the repetitive injuries have been. And then usually around, again, like we said, like those proteins start forming around the blood vessels and then deep folds in the brain. And then it can be like pretty unevenly spread out. So then Alzheimer's tends to affect the whole brain a little bit more evenly, dare to say uniformly, but starting in areas that involve with memory and then spreading widely. And then in Parkinson's, this condition starts at a very specific part in the brain, which can lead to those movement disorders that we highly associate with Parkinson's. Again, all these things, that's why, like I said before, it's like we really need to take the whole entire history of it, compare imaging, and then we can really tailor that specific diagnosis to what is actually going on. But it's difficult because a lot of these neurodegenerative diseases take a really long time.
Yeah.
So by the time that you are like having all these symptoms, then we can probably say like what's going on. However, if you're a football player, which is just like the most common example,
right,
or the most like famous example.
Exactly.
It's like if you're a football player and you're suffering from a lot of like memory loss and irritability, it's like red flags. Yeah, exactly.
Red flag at that point. Yeah.
And then again, like the symptoms also differ too in whatever we're specifically talking about. So in CTE, symptoms are those mood changes, aggression, memory problems. After years of head injuries, it just gets worse. Alzheimer's usually begins with memory loss and confusion, gradually affecting other mental functions. And then Parkinson's usually starts with movement problems, like maybe the tremors that we see, or like stiffness, maybe your gait, like that shuffling gait. And then all of that can affect memory later.
Okay. Exactly.
Also, age is a really big thing, which I'm glad we're talking about, because this is how we can differentiate. This is literally how like we function as doctors. It's like age, sex, all these things. And like that, we start tailoring like, okay, well, what's more common in females? What's more common in males? What's more common at this age? What's more common at that age? And then, because this is all part of that history, right? And then usually CTE is a lot younger people, right? Because it's these repetitive traumas from an early start. So maybe you can even see this maybe in your 20s and 30s, which is insane.
It's insane.
It's like the start of your life.
I know.
And then Alzheimer's usually start later on in life, maybe around your 60s. However, there are cases of early onset Alzheimer's, which is extremely sad.
It's really sad, yeah.
And then diagnosis, unfortunately, again, we've been talking about a ton of times, we had to do a brain biopsy. So that's going to be post-mortem. And then in Alzheimer's and Parkinson's, these can actually be diagnosed in living patients and through brain scans and other tests. And there's actually a lot of screening tests coming out with Alzheimer's. So things are advancing in our future.
Absolutely.
And then treatment approaches can be really different. There's really not a lot of specific treatments. It's kind of just like stop getting hit in the head.
Yeah. Yeah. I mean,
So that you can, because once the injury is there, you don't want any of this to become permanent.
yeah. Yeah.
So there's no specific treatment. Care is really focused on just managing your symptoms and preventing other injuries. So stop getting hit in the head.
Yeah.
Alzheimer's, Parkinson, there's no cure, but there's a lot of medications that we've been able to use. And who knows, maybe in the future,
yeah.
these medications will also help or cross a little bit into the world of CTE.
Right.
Again, because it's gaining like so much popularity and more popularity, more awareness, more research into it, more things that we can find out about it. But who knows, maybe 10 years down the line, you'll see us talking about this.
Exactly.
You know?
Exactly. Yeah. I mean, so then I was wondering, like, what else? Is there anything new in the world of CTE, of diagnosing and helping differentiate this? So then let's talk about a little bit of do genetics have any say in CTE? So while repeated head impacts are the main cause, genetics can play a role in determining who might be more susceptible to developing CTE. Like she's saying, history is always important. Family history, having family with dementia might increase a person's risk of developing CTE. So this suggests that there is like potentially maybe like some genetic factors that are passed down, from families, making some individuals more vulnerable than others. And then there's a genetic variation. So scientists have found that differences in certain genes might affect a person's likelihood of developing CTE or how severe it even can become. So then there's certain genes of interest. One of them is APOE gene, and this gene is also linked to Alzheimer's, which might influence the CTE risk. So some versions of this gene might make a person more susceptible to brain damage from some head impact. Then you have MAPT gene, and it's responsible for producing the tau protein, the one that we're talking about that develops in clumps and then starts causing problems in the brain. And then this variations in this gene might affect how it behaves in the brain and potentially influencing CT developments. And then you have a very long one. So it's TMEM106B gene. I'm not going to test you on that. So another gene that scientists are studying for its potential role in CTE. So it's really cool to see that they're starting to find...
tailor it.
Yeah, exactly. So then why does this even matter? Why do genetics even matter? Well, it could help explain why some people develop similar symptoms with these head impacts versus others that don't. It also allows doctors to identify people who are at higher risk for developing CTE. So then should you engage in these activities or not? What should you do? It could kind of help you make those decisions as well. And in the future, it could lead to new treatments that could target these genetic factors to prevent or even slow down CTE. So that's why it's pretty interesting, and I'm glad that they found them.
So Jules was talking more about screening and genetic screening, which I think the world of genetics is the future. I feel like everyone's just going to go get their genes tested and see like what works for them and what doesn't.
It's a slippery slope because then you find out too much and then you're like, oh my God.
Yeah, I can't do it. I'm more of like ignorance is bliss. So I can't like know things in the future because I'm just going to be traumatized. But now there's other things like in like screening developments. Okay. So imaging techniques, right? So scientists are working on improving brain imaging and in methods to detect CTE. So what happens if now, like if you're an athlete that plays certain impact sports, maybe you should be getting like MRIs a little bit more often.
Yeah.
So advanced MRI scans are being developed to look at brain structure and in more detail. Special PET scans usually that are using tracers that attach to abnormal proteins. So basically a PET scan think of something like a tag, and then they inject this tag into you, and then that is going to attach to these tau proteins. So then all of a sudden, all those tau proteins are lit up on your imaging, right?
Super cool.
And that's what a PET scan is. It really like lights up like whatever you want to target. Those special PET scans using tracers that attach to these abnormal proteins in the brain are really showing like a lot of promise in identifying CTE related changes.
Because if you have more tau proteins, that means that there's something going on there.
Yeah. And again, like remember how we said how like CTE is going to be like more unevenly distributed, and then Alzheimer's is more evenly. So this is information and ways that we can like really differentiate these neuroprogressive disorders.
Yep.
So blood tests also, like we have kind of mentioned that there's blood tests now even for Alzheimer's. So researchers are kind of exploring the blood tests that could help diagnose CTE as well. So they're looking for a lot of specific proteins in the blood that might indicate that these are the same proteins that are causing these issues in your brain.
Yeah.
One promising marker is a protein called CCL11, which seems to be higher in people with CTE compared to those with other brain diseases. So imagine you get a blood test, you measure that level. If you have high levels in your blood, I don't know. I guess that's how they are going to manipulate that information.
Another differentiating factor. Yeah. All right, so then there's treatment research. And while there's obviously still no cure yet, scientists are working on several approaches. Like we had talked about targeting the tau protein. There are drugs that prevent tau from clumping together, which when it happens, that's when you see the symptoms like Alzheimer's and all that happening. And then also vaccines that could help the immune system clear up abnormal tau. Let's see. And then, of course, reducing inflammation. So since brain inflammation plays a role in CTE, anti-inflammatory treatments are being studied to go ahead and treat that. Then some researchers are looking at existing anti-inflammatory drugs to see if they could even help. And then there's, of course, new drugs that are being designed to reduce brain inflammation, and they're in the early stages of testing right now.
Which is so cool to think about. Imagine if they create this drug that a person suffers a pretty severe impact and develops a concussion, and they give them a medication like straight right off the bat to even reduce any kind of inflammation that might be already happening. So, maybe your symptoms that you may have had that were a lot, you significantly reduce, which reduces your risk of these long-term CTE.
It's incredible. Yeah, it's incredible. So then also in protecting brain cells, scientists are also exploring ways to protect and support a healthy brain. This includes investigating drugs that might help brain cells survive and function better in the presence of CTE-related damage. And then, of course, there's lifestyle interventions, right? And studies are examining whether exercise, diet changes, or cognitive training can help slow down the CTE progression.
Which, spoiler alert, it most likely does.
Probably does.
Like every single thing that we've read up on.
Of course. Diet's like everything. And the more and more research goes into the mind gut, like the more it's incredible. So we're going to talk a little bit about notable and famous people who were actually diagnosed with CTE, just to give you guys an example. Maybe some of you, I didn't know this because again, I barely know anything about football, but my husband knew about it. So Junior Seau, or I forgot how you say the last name. So he was an NFL linebacker who played for 20 seasons, and he was posthumously diagnosed with CTE after his suicide in 2012. It's just
posthumous. Never heard that word in my life.
Really?
Posthumously.
Yeah. I guess I have because of all the true crime that I listen to. Anyway, so then there's Mike Webster.
Always learning something.
Yeah, Mike Webster, a Hall of Fame center for Pittsburgh Steelers, and his autopsy in 2002 led to the first diagnosis of CTE in an NFL player. And then, like I had mentioned, Aaron Hernandez, so a former tight end for the New England Patriots, he was diagnosed with severe CTE after his suicide in prison in 2017. Definitely check out the Netflix documentary Killer Inside, The Mind of Aaron Hernandez. Really good documentary. And they really talked about the CTE of it all and all that. I highly recommend it. It was a great documentary. Then there's, of course, like we had said, it's not only limited to football players, but it's many contact sports. So boxing, Muhammad Ali, I don't even have to mention who he is. So he was diagnosed with Parkinson's during his lifetime, but many experts believe he likely had CTE to his boxing career. And then hockey players, that's one that's not very,
often talked about.
Yeah. Incredible, but it totally makes sense. It's pretty much football on ice.
I was gonna say, if you've ever been to a hockey game,
and then again, still
for the glass, and then they fight with each other, which is probably not like an impact. That's
but still, you're hitting heads pretty hard.
No, definitely. When you see a really bad tackle into one of those hockey players into the glass,
yeah, you saw a lot of them in Tampa.
I love hockey.
Yeah.
Love hockey.
Anyway, so Bob Probert, a former NHL enforcer known for his fighting skills. He was diagnosed with CTE after his death in 2010. And then you have other athletes. So Chris Benoit, I'm going to say it the French way. I don't know, whatever. Don't crucify me now. A professional wrestler who was found to have severe CTE after his death in 2007. So a wrestler, you see? So yeah, obviously all of these famous cases, and like, it actually has helped increase research and changes in sport regulations. So it's good to mention because there's so many. It's like all these industries. So you have the NFL, you have the like wrestling, you have boxing, you have so much money in all of these industries. So I'm glad that they're being focused. It's it's an unfortunate example, but they are examples of like more is needed, you know, to like either stop or help or change or whatever it is, to keep playing these sports, keep doing these sports, but like in ways that could kind of like help out, kind of prevent as much as they can from CTE happening.
Yeah.
But yeah, that was CTE, guys. Thank you guys for tuning in.
Yeah. Thank you guys. We really appreciate you tuning into our episodes. Check out on everywhere. Julie knows all the names, but we're literally everywhere.
Oh yeah, we're in every
single time someone asks me, where can I listen? I'm like, literally.
Listen. You could Apple Podcasts, Spotify, YouTube, watch or listen on YouTube, patreon.com/Funny Medicine Podcast. Check us out there. We have over 60 episodes exclusive for our Patreon subscribers, and you would definitely be helping out the show. Our patrons are the MVPs.
Yeah.
And yeah, listen to us anywhere. We're even on Google Podcasts. We're anywhere. I've made sure of that.
And if you can't find us somewhere, let us know and we'll be there.
Yeah, and I will fix that. But I'm pretty sure that we're everywhere.
Sure we're on all common platforms.
Exactly. So yeah, and if you guys have any suggestions on anything you guys want to listen to, watch, whatever, let us know on any social media platform as well. We're on Twitter, Facebook, Instagram, Threads. We love our Threads. So talk to us anywhere, and we'll see you in the next one.
Bye.